Hi, my name is Dr. Cirecie West-Olatunji, and I am co-founder of CRESTS-Achieve. This is an introduction to the CREST-Achieve program. One of the things that I'll be talking about very briefly is about how Black children in particular experience traumatic stress due to structural racism in every aspect of their lives. I'll also talk about traumatic stress as a causal agent in psychological and physiological harm for Black children. And then I'll conclude by talking about interventions for traumatic stress and why they need to be culturally situated for optimum effectiveness in mental health. So it's important for us to understand structural racism, traumatic stress theory, and culture-centered responses. So when we think about structural racism, we're really thinking about ways in which racism as a systemic factor in the lives of Black children and their families affects them in their home settings, their school settings, and in the clinical settings. At home, we know that how people parent has a lot to do with how resilient they are and what coping skills they have in dealing with the day-to-day structural racism and the microaggressions that Black people experience. In the school setting, we're talking about educational hegemony and the ways in which Eurocentrism causes disturbances for children when their values from their homes, their cultural values are not included, valued, or connected to the learning that is being offered in the school setting. Finally, in the clinical setting, we know that structural racism exists in terms of the lack of attention toward culture-centered counseling theories, in our conceptualization, in our interpretation of Black children's behavior, and our over-diagnosing them or over-categorizing them for particular special education categories, particularly in terms of behavior disorders and also learning disorders. When we think about traumatic stress, we really are talking about something different from possibly you've heard about post-traumatic stress disorder, PTSD, but thinking about traumatic stress as being something that is continuous, that is pathological, that in which people act with impunity and is in the present and future rather than the past. Traumatic stress is related to historical trauma because historical trauma talks about the trauma over several generations. So we understand that these things don't go away. The racist acts continue even to today. So it's continuous. Also, in thinking about how parents parent has a lot to do with how they have resolved their issues around the racial trauma and race-related stress. So we know that the responses to the trauma are passed on from generation to generation through transgenerational or intergenerational trauma. We know that the outcomes have deleterious, harmful, negative effects on children and their learning, their cognition, their interpersonal skills, and also in terms of their own development, both the social development as well as emotional development. So we want to concentrate on minimizing the impact of traumatic stress. When we think about culture-centered responses, it's important for us to be knowledgeable about the role that African American identity plays in wellness for Black children. So we need to understand that much of the literature around ethnic identity for Black children suggests that it serves as a mitigating factor for children as they experience the harsh realities of a racist environment. Also, we need to understand about Black mental health, and there's very little attention, if any, paid in the training of mental health professionals to determine exactly what is Black mental health, and is it the same as it is for whites, for people of European descent. We in CREST believe that's not true, that there are various characteristics of Black mental health that are not shared with a Eurocentric worldview, including an emphasis on diunital thinking rather than dichotomous thinking and polarities, of understanding that the invisible world is understood or manifested by the visible, concrete world, that we definitely understand that Black conduct, the conduct of our children, is a behavioral representation of Black thought. And so what we want to do is make sure that Black children have a view of themselves that is accurate rather than the stereotypical view that predominates the literature and practice with Black children. So CREST, what is CREST? CREST is an evidence-based, culture-centered program that reconceptualizes Black children. In particular, CRESTS-Achieve is a culture-centered, trauma-informed care program that counters race-based trauma and continuous traumatic stress in order to transform the lives of Black children in their home and school environments to promote academic excellence and socio-emotional well-being. So it's important that this is just an introduction to CREST. We recommend that you go to our website, which is CRESTprogram.com. That's CRESTS program, all one word, CRESTprogram.com, where you can get additional information. We have white papers, we have videos, and also there is a free webinar that you can view and is available. Click on the link and it takes you to a YouTube video. We also will be adding more. We also have a newsletter. And so we invite you to join us in this conversation. Also, I recommend that you consider continuing your work by reading and reading more. So I'm going to share with you 2 articles that are available online. So you definitely could take a look at these. One is Rite of Passage Programs as Effective Tools for Fostering Resilience Among Low-Income African American Male Adolescents. This is open access. You're welcome to download this, so feel free to locate this. Also, Positioning Toward Mathematics and Science Learning, an examination of factors affecting low-income African American girls. And again, there is a link available to you that you can access. It's open access, so you don't have to be connected to a university in order to be able to access these. I do recommend that you consider reading further about this issue. Also, I have for you some videos that you might be interested in, and I'll pull that up also. So we have a video, Trauma-Informed Care for Black Children, What's Culture Got to Do with This? And this is a free video that we're offering to you. It's about an hour long. We have guests, Dr. Joyce King of Georgia State University, and also Dr. Michael White of Xavier University of Louisiana. And we have another video available to you, Impacts of Race-Related Stress on Children. Both of these are available through our website. So feel free to go on and continue your learning in this area. We hope that you will join us for future trainings. We do have a 4-part series that is available to you. And you can certainly take a look at that and decide on whether or not you want to begin your training in the area of culture-centered trauma-informed care. Again, our website is CRESTSprogram.com. If you want to email me, you can email me at CRESTSprogram@gmail.com. Thank you so much, and we look forward to you beginning your journey toward becoming a culture-centered, trauma-informed clinician or parent or educator. Thank you so much. Bye.